Staying healthy isn't easy, especially during the holidays. Watching your diet, staying active, managing stress. But a good night's rest helps boost your overall health and wellness. And it couldn't be easier. The Sleep Number 360 smart bed senses your movements and effortlessly adjusts to both of you. The result? You wake up ready for anything. Bring proven quality sleep home for the holidays. It's our Black Friday sale. Save 50% on the new Sleep Number 360 limited edition smart bed, plus special financing. Ends Monday. Special financing subject to credit approval. Minimum monthly payments required. See store for details.
When you love your team, you spend every moment wondering what they're doing. Well, stop wondering. Get Contour TV from Cox and follow them anywhere, anytime with the Contour app. Plus, use your voice remote to search and filter games or record one that starts past bedtime. Because even a 24/7 fan has to sleep, occasionally. Learn more at cox.com/sports.
Welcome to the Beverly Hills Plastic Surgery Podcast. This is Dr. Jay Calvert and Dr. Millicent Ravello. Dr. Millicent Ravello, how are you?
I'm doing excellent. How are you?
I'm pretty charged up after a day of severe, complex nasal reconstruction and rhinoplasty.
Yeah, you were operating like a machine today.
This was a big day.
Churning them out, those noses. 2
rib grafts and a division of a forehead flap, an inset and division.
That's a solid day.
It's a lot of work.
It's a lot of work.
It was good. Went very well. I think I got to carry that momentum into my 30 patients on the schedule tomorrow.
Oh, that's rough. I don't know what's harder, a full day of patients or a full day of surgery. Actually, I do know which is harder, but they're equally.
They have their challenges.
They have their
and they have their upsides and their downsides.
But yeah.
And that's kind of what we're here to talk about today, is the importance of post-operative follow-up.
Yes. So that was my day today, was a full day of patients, some new consults, but a decent amount of patients that were here for their follow-ups. And my schedule stays pretty full with follow-ups because I really think it's important to follow my patients very closely. And so that is the impetus for this podcast.
Yeah, you had some stuff where you were sort of like, how do they not follow up after I do these operations for them? Like, how do they think it's okay to not come back?
To be fair, most of my patients have learned that I find it very important, and they do follow up. And the challenge becomes when it gets, the challenge is if you don't live in the area or if you don't live close,
right,
then it definitely becomes onerous for the patients. And I understand that, driving an hour, sitting in traffic, it's a pain in the butt. Like, I totally get that. But I also think that it's incredibly important that they follow up, or I wouldn't ask them to do that and make that sacrifice to come. Because for whatever surgery it is, whether it's a nose or a face or the breast or a tummy or a liposuction, catching things early is so important for an excellent outcome.
Yeah, and the follow-ups are part of the care. It says that in the consent forms.
Yes.
If you read the consents, there is a section that says that I recognize that following up after surgery is essential to the outcome of my operation.
Yes, absolutely. And every surgery is a little bit different, but certainly there is a sort of standard cadence to my follow-ups. And usually it means that I see the patient, the next day after surgery or within 2 days, 3 at the most, depending on the, severity of the surgery. And then I like to see them at 1 week, and then at 3 weeks, and then 6 weeks, 3 months, 6 months, 1 year. That's sort of my standard for most surgeries.
Same.
Now, different surgeries may have more follow-ups in that early time period. So if you have drains in, I will typically see you every week. If you're a breast reconstruction patient undergoing expansion, I'm going to see you every week. Or if you're having any kind of wound issues or complications, I'm going to see you on a weekly basis. Because I find that in those instances, I really need to follow them closely to see what's happening